Disease does not begin when we feel it, not when it appears on imaging, not when a number suddenly rises. It begins when signals shift, and we fail to notice. The body does not jump from health to collapse. It drifts, slowly, quietly, without headlines. How does it truly begin? Not with pain, not with diagnosis, but when circadian rhythm begins to drift without stopping. Inflammatory markers rise within normal limits. Cellular resilience slightly declines. Compensation replaces regulation. At that moment, disease has not appeared, but it has started. Late. We simply fail to listen to the first whisper. The real problem. Conventional medicine measures outcomes, but the body lives processes. The lab captures a snapshot. Disease develops in the film. Numbers move gradually, within safe ranges, until they cross a threshold. And we say, now it has begun. But it didn't begin now. It just became visible now. Mazen felt mild fatigue. Not severe. Not alarming. His labs? Normal. Blood pressure? Acceptable. Glucose? Within range. But for years. Fragmented sleep. Chronic pressure. Fluctuating glucose. Gradual weight gain. Then came the diagnosis. As if it appeared overnight. But it wasn't sudden. It was silent. There was no single event. There was a long trajectory unmonitored. The scientific reality. Most chronic diseases pass through an early functional phase, before structural damage appears, a stage invisible to routine tests, yet biologically decisive. We don't discover disease late because we are careless. We discover it late because we search for it in the wrong place, where Roots AI intervenes. It does not wait for collapse. It monitors trends, not just values. Loss of cellular resilience, silent metabolic stress, circadian misalignment. The moment balance shifts into compensation.
Because real prevention does not begin at diagnosis. It begins at the first whisper, before it becomes a scream. Dr. Holly, how many small signals have you ignored simply because they were not painful yet?